Hey everyone! Welcome back to the channel. Today we're diving into a really important topic, 15 signs of kidney disease that you can actually see on your body. Your kidneys are small but mighty organs. They clean your blood, remove waste, balance fluids, and regulate blood pressure, all without you even noticing. But when something goes wrong, your body starts sending signals. The key is, you have to notice them before it's too late. Before we begin, don't forget to hit that subscribe button, give this video a thumbs up, and turn on notifications so you never miss new videos that can help you stay healthy and informed. Alright, let's jump in. 1. Swelling in your ankles, feet, or hands. When your kidneys start to lose their ability to filter sodium and fluids properly, your body begins to retain water. This excess fluid tends to accumulate in the lowest parts of your body, your feet, ankles, and sometimes even your hands or face. You might notice your shoes feeling tighter than usual, or socks leaving deep marks around your ankles. Rings that used to fit comfortably might suddenly feel snug. It's easy to dismiss this as just water weight or too much salt, but persistent swelling, especially if it doesn't go away after rest, could be one of the first visible signs that your kidneys are struggling to keep up. 2. Puffy eyes. Have you ever woken up with puffy eyes that don't seem to go away no matter how much you sleep? Puffy eyes are not just a cosmetic issue. They can signal that your kidneys are leaking protein into your urine instead of keeping it in your bloodstream. Protein is essential for maintaining fluid balance in your body. When you lose it through urine, the fluid can build up around the eyes, especially in the delicate tissue under them. If you notice persistent puffiness, particularly in the morning, and it's not just from allergies or lack of sleep, it's worth asking your doctor for a urine test. It's a subtle but powerful warning sign. 3. Changes in urine. Your urine tells a story about your kidney health. Pay attention to color, smell, and frequency. Color. Healthy urine is pale yellow. Dark, tea-colored, or cloudy urine can mean blood, protein, or waste buildup. Frequency. Going to the bathroom much more often, especially at night, or much less often than usual may indicate your kidneys aren't filtering correctly. Foaminess. If your urine looks foamy or bubbly, that can mean you're losing protein. Even small, consistent changes in urine can be early indicators of kidney disease. Don't ignore them. They're your kidney's way of crying for help. 4. Fatigue. If you feel constantly tired even after resting, your kidneys might be to blame. Healthy kidneys produce a hormone called erythropoietin, which tells your body to make red blood cells that carry oxygen. When kidney function declines, this hormone drops, and your body produces fewer red blood cells. The result? Less oxygen reaches your muscles and brain, leaving you exhausted and weak. This can feel like chronic fatigue, difficulty concentrating, or even shortness of breath during simple tasks. It's not just being tired. It's your body running on low oxygen. 5. Dry, itchy skin. Your skin reflects what's going on inside. When kidneys can't balance minerals and nutrients, waste products build up in your blood. This imbalance often shows up as dry, flaky, or itchy skin. People with kidney issues often describe the itch as deep under the skin, sometimes so uncomfortable it affects sleep. It's caused by a buildup of phosphorus or other toxins that your kidneys can't properly remove. If moisturizing doesn't help and the itch is persistent, especially if you also notice other symptoms like fatigue or swelling, it might not be a skin problem at all, but a kidney one. 6. Metallic taste in the mouth. When kidneys can't remove waste effectively, toxins like urea build up in the bloodstream. This can change how food tastes and make your breath smell bad, a condition known as uremic breath. People often describe a metallic or ammonia-like taste in the mouth, or say that food suddenly tastes off. Some even lose their appetite entirely because nothing tastes right. If brushing your teeth doesn't fix the problem and the metallic taste persists, it could be your kidneys trying to tell you they're overloaded. 7. Nausea and vomiting. As kidney function worsens, the buildup of waste products in your body can affect your digestive system. You might start to feel nauseous, lose your appetite, or even vomit for no obvious reason. This happens because the toxins that your kidneys should remove instead accumulate in your blood, irritating your stomach and making you feel sick. If you're losing interest in food or find yourself feeling nauseous regularly, don't just dismiss it as a stomach bug. It might be a sign of deeper issues. 8. Shortness of breath. You might not immediately connect your breathing with your kidneys, but they're linked. When kidneys can't remove extra fluid, it can accumulate in the lungs, making it hard to breathe. Additionally, anemia caused by kidney disease means fewer red blood cells are carrying oxygen through your body, so you feel winded even after simple activities like walking upstairs or talking for a long time. If you notice unexplained shortness of breath, especially if it's combined with swelling or fatigue, it's time to get checked. 9. Cold hands and feet. Have you ever noticed that your hands and feet feel cold all the time, even when the room is warm or when everyone else seems comfortable? You might think it's just poor circulation or that you run cold, but constant coldness in your extremities can actually be a warning sign of kidney disease. Let's break down why this happens. Your kidneys play a crucial role in maintaining balance in your body, not just in filtering toxins and waste, but also in regulating blood flow, red blood cell production, and body temperature. When your kidneys aren't working properly, several things can go wrong that make your hands and feet feel icy cold. 1. Anemia caused by kidney disease. One of the biggest reasons for that always cold feeling is anemia. Healthy kidneys produce a hormone called erythropoietin or EPO, which tells your bone marrow to create red blood cells. These cells carry oxygen to all parts of your body. When the kidneys are damaged, they produce less EPO, which means your body makes fewer red blood cells. With fewer cells carrying oxygen, your muscles and tissues receive less warmth and energy. As a result, your hands and feet, the furthest points from your heart, are often the first to feel the chill. This isn't just mild discomfort. People with kidney-related anemia often say their hands feel numb or like ice, even when wrapped in blankets or gloves. They might also look pale or have bluish fingertips. 2. Poor circulation. Another factor is poor blood circulation, which is closely tied to both kidney and heart health. When your kidneys can't properly balance salt, water, and minerals, it puts extra strain on your blood vessels. Over time, this can lead to narrowed or stiffened arteries, which restrict blood flow to your extremities. So even if your body temperature is normal, your hands and feet may not get enough warm blood to stay comfortable. If you've noticed your toes going numb in the cold, or if you often feel tingling sensations, this could be a result of that impaired circulation, not just bad weather. 3. Low body temperature. Your kidneys also help regulate your metabolism. When they're not functioning well, your body's overall metabolic rate can slow down. That means you're generating less internal heat, and you feel colder in general. This is often combined with muscle weakness, fatigue, and pale skin, all of which are symptoms connected to poor kidney performance and anemia. 4. Fluid imbalance. Another, less obvious reason is fluid imbalance. Healthy kidneys maintain the perfect balance between the amount of fluid you take in and the amount you excrete. But when they're not working properly, extra fluid may stay in your body, or in some cases, you may become dehydrated without realizing it. Both of these situations affect blood volume and circulation, which in turn influence how warm or cold you feel. You might experience swelling in your legs but still feel cold, a confusing combination that happens because trapped fluid doesn't necessarily provide warmth. What you can do about it. If you suspect your cold hands and feet might be linked to kidney problems, here's what you can do. 1. Check your iron levels and hemoglobin. These will show if you have anemia related to kidney disease. 2. Monitor your blood pressure regularly. High or unstable blood pressure can worsen kidney function. 3. Stay warm and move often. Light activity helps stimulate circulation and oxygen delivery. 4. Eat foods rich in iron and B vitamins such as spinach, lentils, fish, and eggs, but check with your doctor first if you have kidney issues, since some foods may be restricted. 5. Talk to your healthcare provider. They can test kidney function with simple blood and urine tests, specifically checking your creatinine and GFR, glomerular filtration rate. If it turns out your kidneys are struggling, early treatment can prevent further damage and improve symptoms like chronic coldness. 10. High blood pressure. Your kidneys and your blood pressure are closely connected. The kidneys help regulate blood pressure by managing fluid balance and releasing hormones. When they're damaged, they can't do that job properly, leading to chronic high blood pressure, which in turn causes more kidney damage. It becomes a dangerous cycle. If your blood pressure remains high despite medication or lifestyle changes, Your doctor should evaluate your kidney function. Many people discover kidney disease only after years of unexplained hypertension. 11. Back pain or side pain. Pain in your lower back, just below the ribs, could be linked to your kidneys. It's often described as a dull ache or sharp stabbing pain on one side. Kidney stones, infections, or polycystic kidney disease can all cause discomfort in that area. If the pain comes with fever, nausea, or urinary changes, seek medical attention quickly. Kidney infections can spread fast and become serious. 12. Muscle cramps. If you experience frequent leg cramps or spasms, your kidneys might be the reason. Kidneys regulate important minerals like calcium, sodium, and potassium. When they're out of balance, your muscles don't function properly, leading to painful cramps, especially at night. You might think it's dehydration or overexertion, but if cramps are frequent and persistent, especially along with other symptoms, your kidneys might not be keeping up. 13. Trouble concentrating or dizziness. Poor kidney function leads to an accumulation of toxins in your bloodstream and a lack of oxygen to your brain. This can make you feel mentally foggy, dizzy, or have difficulty focusing. You might find yourself forgetting things, feeling confused, or unable to complete simple tasks. If your thinking feels cloudy and you can't pinpoint why, it might not be stress. It could be a result of kidney-related anemia or toxin buildup. 14. Persistent itchiness or rash. Sometimes waste products build up to the point that they irritate the skin, causing rashes or uncontrollable itching. This itching isn't always visible from the outside. Your skin may look fine but feel like it's burning or crawling. In advanced kidney disease, the waste that should be filtered out starts affecting every part of your body, including your largest organ, your skin. If itching is constant and unexplained, it's worth a visit to the doctor. 15. Weight loss and poor appetite. When your kidneys are failing, toxins in the blood can suppress your appetite, change how food tastes, and cause nausea. This can lead to unintentional weight loss over time. You might find yourself skipping meals without realizing it, or feeling full quickly. Sudden unexplained weight loss, especially with other symptoms like fatigue, changes in urine, or swelling, should always be investigated. Your body may be struggling to maintain balance. Let's quickly review. Swelling, puffy eyes, urine changes, fatigue, dry or itchy skin, metallic taste, nausea, shortness of breath, cold hands and feet, high blood pressure, back pain, cramps, trouble concentrating, itchiness, and weight loss. These are the 15 key warning signs your body might show if your kidneys are in trouble. If you notice 2 or more of these signs, don't ignore them. Visit your doctor and ask for blood and urine tests to check your kidney function. Early diagnosis can make all the difference. So how can you protect your kidneys? Stay hydrated. Water helps your kidneys flush out toxins efficiently. Limit salt and processed foods. Too much sodium puts strain on your kidneys. Control blood pressure and blood sugar. These are 2 major causes of kidney failure. Avoid excessive painkillers and alcohol. Both can damage kidney tissue over time. Get regular checkups, especially if kidney disease runs in your family. Your kidneys don't shout, they whisper. The earlier you listen, the better your chances of protecting them for life. If you found this video helpful, please like, share, and subscribe. It really helps our channel grow and reach more people who might need this information. Drop a comment below. Which of these signs surprised you the most? And remember, your health is your greatest investment. Take care of your kidneys and they'll take care of you. Thanks for watching and see you in the next video.